Hi, good evening, friends. I'm Dr. Mahesh Nair, cosmetic plastic surgeon from Nepantech Aesthetics, Panampedi Nagar, Cochin. And today I'm here back on YouTube Live. I mean, last week I was on Insta Live, this week on YouTube Live with a topic that I was suggested there mainly by some of my clients that I should cover breast reduction as well. So, coming back to the topic of breast reduction, there are a few very common questions that come to me. I wouldn't say really common, but very thoughtfully asked questions, which are very practical and which really deserve an answer from any cosmetic plastic surgeon who's going to undertake this type of a surgery in in a female who's really concerned with not only the result but also the outcomes of the breast reduction surgery as well as the sequelae that follow. It's not that only complications or something that can occur, but it's like every surgery leaves some kind of a sequelae behind it that one has to live with. So you are as a surgeon, my job doesn't get over with just the surgery itself. It is it's a journey. It's a journey with my client or my patient that I see through with them as they undergo the whole process of not just the surgery but the life after the surgery as well. And breast reduction surgery is definitely one amongst these because breast reduction not only affects the physical aspect, but it also affects the psychology and a lot of other things in a woman's life, because breasts are an integral part of the feminine image and they make a lot of difference to a woman. So it's like when breast cancer was rampant. Not that it's not rampant now, but the thing is, when breast cancer made sensational, what I can say, where there were many deaths because of breast cancer and things like that. Post mastectomy, women used to live with a flat chest, and their femininity was affected, and they used to not really. It used to not go down well with them. Like a body part has been taken off, it's akin to amputation. So now when a lot of breast reconstructive procedures are available, and women have the choice as to how they can build up themselves once again, things have become a little more easier. So, not deviating from the topic, let me come back to breast reduction. Once again, the camera angle may be a little bit dicey there. Yes. So, coming back to breast reduction per se, one second. Yes, so excessively large breasts are a common problem that many women in our society live with, especially the Asian subcontinent sees that we are generally on the heavier side. Even by the body, our BMIs are a little higher, and so are the breasts. That goes universal from the north of India to the south of India. There's no doubt about it. So breasts generally are a little on the larger side, and many women have these issues of, say, lower neck pain, upper back pain. They sometimes don't know that it is because of the large breasts, but by and by their posture starts changing. They start stooping down, from the upper back, and they start curving in. The shoulders start coming in. Your collarbones start getting those bra marks, and you start getting grooves over here. You start wearing brassiers which are larger, but they don't offer much support, and the breasts tend to sag and deform themselves because of lack of support. And sometimes we have even seen cases where the breasts have reached probably the navel or the umbilicus, and they are really large and heavy. And some women have also complained to me that they are not able to sleep well because the breasts lay on the chest and the chest excursions are limited. Like, सांस लेने में तकलीफ होती है, doctor. Difficult. They find it really difficult to sleep. It's a kind of a little embarrassing because they can't many a times wear the clothes that they want, and participating in sports activities, or sometimes especially the younger girls, they come with complaints like, I can't participate in this sport, I can't do this, I can't do that, doctor, what can I do, please help. So these are the kind of cases which merit a breast reduction. It's not like a woman will just come out of her slumber and say that, I want a breast reduction done. Well, it's usually purpose driven. It is something that is very much experienced by them, that the size is troublesome and I'm not able to conduct my day-to-day life really well, so that's why I need a breast reduction. Well, so if you need one, you should be aware of what it comprises of and what the surgery basically offers. So that's one aspect of it. That neck pain, I just told about that. Sometimes my orthopedic colleagues refer that the patient has got spine pain. I mean, she came with a back pain to the orthopedician, and they said, like, look, the problem is not with your spine, it's basically with your breast. So definitely you need a breast reduction surgery. Plus, moreover, large sagging breasts will have wetness or more moisture underneath the breast in the inframammary fold, so that can lead to fungal infections. And these things, it may be scratchy, the skin may go dark. So it's not only a cosmetic surgery. Breast reduction per se is a reconstructive surgery, wherein it gives a lot of relief to the patient or the client. Not really cosmetically, yes, definitely, I do agree, but even otherwise, it's a very rewarding surgery, frankly. And many times women come to ask me, like, can they are undergoing a what I can say, a mommy makeover. So is this a part of a mommy makeover? Well, yes, breast reduction is a part of a mommy makeover, because generally after pregnancy and lactation, the breasts tend to sag. After lactation, actually, breasts can go two ways. Number one, they can undergo a hypertrophy, which means an increase in the size of the gland, and it is really too large. So that it reaches sometimes the navel. It's called hypertrophy or increase in size. On the other extreme is when they go flat, they go deflated. The whole gland just atrophies and it involutes and it disappears. Sorry, not dissolves. It disappears altogether, and you just have fat, some kind of fat sagging over there with lack of support. So either the breast is sagging without support, or it is sagging with a lot of mass in it, with a lot of weight in it. Either way, the complaint is the same, that my breasts don't look good after my pregnancy and lactation. What should I do, doctor? So your basic aim is to again get back the breast which was found with you in the pre-pregnant state, that is apert, firm breast with nipples pointing forward, and a fuller breast, a firmer breast. Those are the aims and objectives of a breast reduction or a breast lift. Now, technically, both the operations are very similar, frankly, because the incisions, the access route is the same. So in a breast lift, basically, we just adjust the skin cover and lift the breast. Whereas in a breast reduction, we basically reduce the breast, mold it again, and then lift it. So this is like a multitude of surgeries of approaches applied in one particular surgery. And along with this, if it's a lift, you can also go in for maybe an implant or fat grafting to increase the size of the breast at the same time, to prevent that deflated, flattened out look. Well, that's another topic altogether. Maybe in an Insta live or YouTube live, it can be covered. So, coming to breast reduction, here basically we aim at making the breast a little smaller and lifting it up. And another common question that is asked to me, one second, is this light a little excessive? No, I think the light is fine. So, yeah, so coming on to this, that many a times I do find these young unmarried girls who come with larger breasts, and they have this concern that, doctor, they're sagging, I can't participate in sports in the school, in the college, I can't wear this, I can't wear that. I'm sometimes I'm mocked at, like, for having such large breasts and my shoulders too. Those are the main concerns what they have. And the second most important question that all these breast reduction women ask, whether young or not so young, I won't say old, because generally older women do not come with it, but I have got clients who are even of the age of, say, 50. So it's not that any age group is barred from breast reduction. Anyone can come and get a breast reduction done. So the other most common question is, will I be able to lactate, especially the younger unmarried ones? Now, this question has a very complex answer to it. Frankly, it is not very simple. There is no study to perfectly tell you that you will lactate or not lactate. See, normally also many a times, normal breasts, women with normal breasts do not land up lactating due to hormonal influences, due to stress, PCOS. Lot of factors are involved in lactation. There is an interplay of four hormones. There's estrogen, progesterone, oxytocin, prolactin. There are four hormones sitting and playing there. Plus, there are some unknown factors also which are in the perspective. So we can't really categorize that you're going to lactate or not going to lactate. But after breast reduction, definitely, see why you undergo reduction, because you have got a large amount of tissue over there. Now, in younger women, this tissue is mainly comprised of a gland and less fat. In older women, it is mostly comprising of fat and less gland. So logic says that when you do a breast reduction in a younger female, you're taking on more of gland and less of fat. It's obvious. That's why you're undergoing a reduction, and that is the whole idea of doing a reduction in the first place. So if I'm going to reduce the breast gland to make your breast smaller, obviously I'm going to reduce the potential of lactation, but I'm going to leave back some amount of gland and some amount of fat over there. Fat is not the one which produces milk, it is the gland which produces the milk. So some amount of gland which is remaining with the ducts connected to the nipple, areola, basically, are going to function. So you are going to achieve lactation more or less in a way which you would otherwise also, but your potential definitely may come down. There is no scientific study right now available to prove this fact to you, that whether you will or you will not lactate. There's no paper to substantiate this fact, but more or less it is seen, and I have even sometimes come to know from my patients who have undergone a reduction surgery, the younger ones who have later got married, that they could breastfeed. And it is not like the both breasts will not function or something like that. More or less they do. So when we do a reduction, we don't have such a conscious effort in our mind to safeguard this much amount of gland so that you're going to lactate or not, because we can't really tell which part of the gland is going to lactate, and it's beyond us, frankly, to tell microscopically how the situation is going to be in the post-operative period. So that is not a very easy question to answer, I would say. But more or less, yes, lactation would be possible. It's not something that is impossible. So those two, three questions are the ones which are commonly asked to me, like, whether will I lactate? Will this affect future pregnancies? No, definitely. Your breasts have nothing to do with your pregnancy. It is the lactation only and the breast milk production part only which is affected with a breast reduction. So how is the breast reduction different from breast lift? I think I just answered that question, because that is another common question that is asked to me. So in that, basically what we do is the reduction involves you lift the breast, you reduce the size, you mold it again to make it look like nice, round and perfect and trim proper. And then you cover the skin. You also cut out the extra skin and you shift the nipple areola upwards. The same thing you do in a breast lift, but with minimal removal of tissue, and you may rather add tissue during a breast lift rather than removing tissue to support the entire structure. So that's the difference between those two surgeries. The incisions and all remain the same, more or less. That doesn't change. Okay, so how many cup sizes will I come down by? But that's up to you and me to decide when we see your case. That's why for such surgeries like breast reduction and all, I definitely like if I have an in-person consultation, or at least worst come worst, a video consultation. That is at least necessary. Otherwise, there's no what I can say, point in discussing a breast reduction, because I need to have a 3D visualization. Okay, so you can come down to a good 2-3 cup sizes, frankly, because many a times the breast reduction candidates who come to us, they have cup sizes like E, F, G, H, really large breasts, and they can come down to something like a D cup or a C cup, a B cup. Sometimes we generally don't go to the A cup. See, your breast basically should match your proportions of your shoulder, your waist, and the overall form. If suddenly the breasts were there and now they aren't there, it looks really weird and awkward. So we don't need to get into that kind of a scenario where you wish that your breast would have been a little bit bigger. But yes, after the surgery, there is some amount of swelling which remains there for about a month, and then it goes down. So the breast initially may look a little larger, but it will definitely come down, no doubt about that. So how many cup sizes will I come down? That I really need to see you and then decide, because I will be able to tell only when I see the breast and I hear your expectations. Well, do the breasts grow back after reduction surgery? Now, this is another perplexing question. It is not that they grow back, but it is that the gland cannot grow back. It is the fat that gets accumulated more and more depending on your diet, etc. So fat can come back, and that can make the breast a little larger or smaller depending upon your weight loss or gain, and also the skin. Well, with time, everything sags. Your face sags. So even the breasts are going to sag. They have a mass, they have a weight. So obviously they're going to sag. And once when that happens, definitely you may need a lift later. So it's not that you will need a reduction later, but you may definitely need a lift. One sec. I'm just trying a new webcam, guys. Please be patient with me. I'm not really aware of how the placement and all should be, but I hope the video is fine and it conveys what it is supposed to convey. That is very, very important. Okay, so do breasts grow back after surgery, reduction surgery? No, the gland doesn't grow, but yeah, the soft tissue, there is a fat, can come back. So we can, one more question. Why am I not a good liposuction candidate for a breast reduction? And why can't I have a breast reduction done with liposuction? Well, the answer to this is simple. Suppose you are a you have a, what I can say, more gland and less fat, which is generally the case at younger age groups. There you can't do liposuction because you can't liposuck out the gland. The gland is really hard and firm. That is exactly the same thing what happens in the gynecomastia. We cannot just liposuction the whole gland and everything comes out. That's rubbish. If the gland is there, you really need to take it out with a scissor. No vasoring, no amount of any kind of stimulation that you're going to give with any kind of machine is going to take out the gland. No machine can dissolve the gland. You have to physically go in with a scissor and chop it out. So the gland, even in a female or a male, it's removed the same way. There's no two way to it. In males, it happens with a keyhole. In females, yeah, we have to open up the breast because you have to shape it and mold it. Men don't want it, women want it. So we have to recreate a good breast which looks good for your chest and your body proportions. So definitely, yes. So yeah. So what I was going to say is, yeah, liposuction. Liposuction works in older women wherein there is more of fat and less of gland, which can definitely be liposuctioned out. Sometimes it's not even older or younger. Sometimes it's just how your breast architecture is. In some younger breasts also you have more fat. In some older breasts also you may have a substantial amount of gland. So one or two investigations that really tell us more about the breast is, if you're so concerned with what modality of treatment to use, we get an MRI done, or even a sonomammography or an X-ray mammography can help. If I see that the breast is laden with dense tissue, then I know for sure that that is a gland and I need to reduce it surgically. If I see that it is more laden with fat, then I know for sure, and even touch tells me where the fat is distributed. So once when I know where the fat is, I can definitely go and do more liposuction than reduction. So anyway, in all breast reduction cases, we do liposuction. We take out the axillary tail if it is there, the axillary breast tissue basically, not the tail. The soft tissue or the fat which is there in the axilla, the armpit basically. So all that fat can also be taken out to give the lateral side, the outer side of the breast, a nice round, which which is aesthetically very pleasing. Everybody looks for the cleavage, but many women forget about that side curvature, which really defines a breast rather than just the cleavage. So it is not only the cleavage that matters; it is the overall shape of the breast also that matters. And what else? Should I lose weight before breast reduction? This is another common question. Well, weight reduction is anytime good before any cosmetic surgical procedure, because lower the weight, lower the amount of anesthesia needed per kg, lower the need for drugs, medicines, everything comes down, and your BMI, the lower it is, the faster you heal, the quicker you heal. So definitely, it's not that your breasts are going to reduce on their own if you undergo weight reduction, but yes, definitely the amount of fat is going to come down, and that will make our job easier and better. So definitely weight reduction before any surgery helps. How do I prepare before a breast reduction? Well, it's very simple. It's just like any other cosmetic surgical procedure done under general anesthesia. So we do it under GA, a short general anesthesia, not short exactly, but a general anesthesia which lasts for say about 2 hours, 2 to 2.5 hours, because that's what the normal breast reduction would take. The larger the breast, more the time it is going to take, a little bit more basically. So on an average, I can tell you that we remove about 400-500 grams per side of the breast, per breast. And the larger ones generally have about 800 to 900 grams in one breast that is removed at a time. We have even done massive reductions of gigantomastia, that is a very large breast, or macromastia. Okay, so in these we normally can take out about 1.2 kgs, 1.3 kgs. So much weight is also sometimes taken out from the breast to give it a good shape. So what we need is basically a complete lab test, your hemoglobin, which is needed. Not that much blood loss happens, frankly, in these cases. Just about 10-15 ml at the max can happen. Maybe slightly more than that, 50 ml. Chalo, all said and done, you assume it is 50 ml. It is not a very massive amount of blood loss. So blood loss can happen. So hemoglobin we take, LFT, RFT, your serum electrolytes. All these small parameters are taken into consideration before we take you up for anesthesia. Anything that is needed for the anesthesia is done in the baseline. We also get a baseline mammogram, X-ray mammo, or a sonomammography. Why? Because if there is a small breast mouse, or what I can say fibroadenoma sitting over there, we can take it out at the same time as as during the surgery. So you don't have to undergo another surgery for it. So of course you need to stop smoking, say about a week, 10 days, or the more the better. I mean, the earlier the better. So you need to stop smoking and stop having alcohol for some time before and after the surgery, maybe 1 month after the surgery, until all the healing takes place. Avoid aspirin, avoid excessive green tea, avoid ginseng, avoid Red Bull, avoid herbal supplements, avoid vitamin E supplements. All these affect your bleeding and clotting parameters. So that is why we need to avoid those. So once when that is done, we can directly take you up for the surgery, and it proceeds like any other general surgery in a supine position, where we take out the breasts, we not exactly the breast, we reduce the size and we reshape them. That's all. So another question which I commonly get asked is, why do my breasts look large even after the surgery? Well, Immediately after the surgery, there's a lot of swelling, there's edema over there, so that's why the breasts look large. We have also infiltrated the breasts with an infiltration fluid so that we can do liposuction and we can achieve, a lesser bleeding while we are operating. So that fluid also remains in the tissues for some time, say about 2 to 3 weeks, and finally that goes down and your breasts nearly come back down to the size what we had decided or we had thought of. So on an average, roughly you can say 3 months. Take 3 months for the breast to settle down completely, and then you assess how they look. So that is roughly the time what I give my clients. Wait for 3 months and then comment, because before that, if you comment on asymmetry, saying, "Doctor, ye bada lag raha hai, ye chota lag raha hai," or when this is looking big, this is looking small. No, that generally what I can say balances itself out, and no two sides of the body have similar swelling or a similar inflammation, because the inflammatory response is not mathematically balanced. It is not like here it is +2, here also I'll make it +2. There is no RHS equals LHS in the human body. Forget it. So many times people ask me, "Doctor, why is there swelling on one side and why is there no swelling on the other side? What should I do? I mean, how does it function like this?" To be very honest, it's human body. Nobody has understood how it exactly functions. We as doctors have learned the art and science of medicine, which helps us give some insight into the human body. We still don't know how the genes work. We still don't know how the brain actually functions. How the neurons actually function. A lot of things are still an enigma in this field. So the human body is very, very difficult to decode. It is the perfect machine that actually exists as of now. So why do my breasts look large? I just answered that. Do I need drains? Oh God, this is like this is like one of the commonest questions that I get asked. So it's like, it depends on the size. If your breast is smaller in size and I can get away with a drain, you're not like an oozer. Like there are some people who tend to give out a lot of fluid when they're hurt or when the tissues are hurt inside. So that I come to know only on the table. I can't make out looking at a person, oh, is he gonna ooze more? Is she gonna ooze more? No, we can't tell that. So it's a very subjective matter, the decision of which is taken in the operation theater at the time when we operate. So if I know that anyway, a larger reduction, say more than 400 grams and all, definitely merits a drain. There is no doubt in that. 48 to 72 hours, that is 2 to 3 days, a drain will remain. A narrow tube that goes into the breast tissue where we have removed, and it comes out from the armpit, so that the small hole gets hidden and obliterated. You don't have to worry, oh God, that will be seen and what will happen and things like that. So that's not going to happen. So the drains are going to take out the extra fluid, the muck and everything that comes out from the breast, and that's why they are necessary. You can't just always obviate out the drains like, "Doctor, I don't like them. Can I get rid of them?" No, you have to wait for 40 to 72 hours. And the next commonest question is, with the drains, can I go home? Yes, of course you can go home. It's not like they're going to fall off or that blood is going to spill over or something. They are nice, compact, what I can say, boxes, which have a negative suction within them, and they suck out the blood. It's not just blood, it's blood tinged fluid. So there's a lot of mixture of fluids in that, and that's how it comes out. Has the camera gone up again a little bit? Yes. Yeah, that's better. So that's how it is that you take out the drains by about 2 to 3 days. Once when you know that the amount of fluid that is coming out is lesser, say about 50 ml and lesser. So that is the time when we generally take out. But we have an overall idea, like if it is straw colored, that is urine colored or something like that, it's time to take the drain off, because any longer a drain is detrimental. You need not have a drain for a longer period of time. Is this light okay? I think it creates a more darkness. So that's about the drains. Yes, a very common question. Will I need to stay overnight? No, definitely not. In my setup, that is not the norm. A breast reduction surgery is a daycare surgery. Trust me, by evening, you will yourself tell, "Doctor, I don't want to stay anymore in the hospital or in the clinic. Let me go home," because you will be that fit and fine. You will be on Instagram. You will be chatting, talking to somebody on the phone, making a video call. Because breast reduction augmentation is generally, any breast related surgery is generally more or less a little less painful. It is not as painful as, say, a tummy tuck or a 360-degree liposuction or anything remotely near that. It is a very balanced surgery. It doesn't give that much pain, and you're not much in discomfort, because that is not the organ of locomotion, or it is not going to move much because we have given enough dressings and all. So it's not going to be that you're uncomfortable with a breast reduction. You can definitely walk yourself home, and I mean, not walk literally, a far distance, but yeah, you can get down into your car or a train and go home. Definitely. So you're not going to need to stay, you don't need an overnight stay. I've just written down pointers over here that I needed to discuss, because there are these common questions that I have asked and I feel like answering them. That's why I'm making this video, so that, it reaches out to you. And so it's a daycare surgery, general anesthesia, quick in, quick out, same day discharge. Drains may be needed 2 or 3 days. So you need to see me at 2 or 3 days generally to take when I take the drain out. Then you need to see me at 1 week, and then maybe at a week after that. That's all. You don't need to keep seeing me again and again, because there's no point in doing that. I just change the dressings weekly. Okay. The only thing that can happen in breast reductions is the skin where the breasts are joined generally tends to give way a little bit at times. Skin dehiscence, what we call, that can happen. Then a lipolytic discharge can come out from the suture line, from the stitch line. Basically, what that means is, breast is a fatty tissue, just like the tummy. So when we do a tummy tuck or a breast lift, breast reduction, the edges of the skin which we have joined together on the underside, okay, that brings me to the lollipop incision. Look at this. So a lollipop incision meaning this is a breast sizer. So we go in from circular like that, and we take a nick down below like this. So that's what the lollipop incision is all about during a breast reduction, breast lift, augmentation, mastopexy, all these procedures. So once when you have taken that incision and you have gone inside and you reduce the whole tissue, it closes like a lollipop, like around the areola and one single line underneath the breast, which generally gets camouflaged really well or masked really well, and the scar generally tends to fade out very well. So at the lower end of that scar, where it joins the IMF, the inframammary fold, the crease of the body and the breast, basically, there sometimes you may get a little bit of discharge. Why? Because that region is perpetually wet. It is it sweats. You must have noticed sweat under the breast. It is a normal phenomena. So that region is always going to be a little sweaty, a little messy, and it can generally open up from there and lead to this lipolytic discharge. Where lipo is fat, lytic is breakdown. So it's a fat breakdown discharge that generally happens from the skin edges, because some amount of collateral damage does happen when we operate, and we don't know whether that fat is going to survive or not at the very edge. Some of it does, some of it doesn't. So some fat which is dead can come out. So don't panic. It is not pus. It is not that your breast is infected, or oh God, what is happening? I'm gonna die. No, you're not gonna die. Don't worry. It's just a little lipolytic discharge which happens momentarily, and then it settles down in about a week or two maximum. So you may need a little dressings for that, maybe once in 4 days, once in 3 days, something like that, but it all settles down. So that's why I generally tell, if I'm doing a breast reduction, depending upon the size, I would definitely like the woman to have 2 or 3 weeks in her hand. 2 weeks for a smaller breast, 3 weeks for a larger breast. So there's no escaping that. You cannot tell that, doctor, I've got 5 days in hand and now you do a breast reduction. Well, if your breast is of the size B and you want to go to A, then yes, possible in 5 days you will heal. But the thing is, a woman will never come with a size B to me to say that now I want a size A. So that is out of question. So larger breast coming to a smaller size, definitely you need some time to recover. It's your body, it's not a machine. Okay. So what you need to do is, after the surgery, you just need to wear a sports bra, or a garment that supports. We many times give the garment during the breast reduction surgery, or if you have a sports bra, if you're comfortable with that, you can wear it. You just need to avoid underwire bras for about 3 to 6 months, and you need to avoid any fancy bras which do not provide any kind of support, because your breast has been operated upon and you need some kind of support to hold the structure back. So either a sports bra or something like that for 6 weeks, around 4 to 6 weeks, and no heavy duty exercises, no heavy weightlifting, no gymming, of course, no kickboxing, no nothing of that sort. So you take some rest and let the breasts heal. That is very, very important. And what else? I guess that covered everything as such. We had a half an hour session, so obviously, I hope it was informative. Whatever common questions I get asked, I've just tried to answer. A similar Insta live session was done a couple of months back, but I guess it went back in the order, so people have lost it, and many new subscribers of mine have not, followers of mine have not yet seen that video. So this video, I hope, helps you a lot in understanding breast reduction surgery from a one-to-one perspective. Like, if this is like, suppose you are sitting with me and talking at a consultation, I would be explaining you all this and much more in a little more depth, so that you understand what breast reduction is all about and how can you get the most out of this wonderful surgery. So thank you all for your patient listening, and I hope this video made some sense to you. Do like and subscribe, and I'll come up with more informative videos. I'm trying to make more lighter videos as well, which used to come earlier, YouTube shorts and all, which give information, but at the same time it's in a little comical way, or it's in a little approachable manner, so that you feel that so that you can actually come to get these surgeries done. It is not that something which is impossible, or it is out of reach or something like that. So don't worry, we do the best for our clients, and I handhold them personally through most of their journeys are even after the surgery. So be rest assured you're in safe hands. So thank you so much for your patient listening, and I'll be back with more. If you have any suggestions, any questions, please feel free to write in the comment section. Get in touch with us at the numbers mentioned below, and we'll be there happy to help you out with anything. Thank you so much. Have a good evening, and bye.